The Islamic Medical Association has 4 clinics. These clinics were established about 30 years ago. All of these clinics are really primary healthcare clinics run by nursing professionals. Of the 4 clinics, one is a mobile clinic, and this mobile clinic really goes to certain areas on a regular basis, especially in Shanga from Monday to Thursday. And of course, it's used for other activities as well. For example, when there's a health day or where there's a fair, or for example, we use it in our Hajj seminars once a year post-Ramadan. And of course, the other clinics are fixed clinics. Our Marion Hill clinic as well has a VCT clinic, the voluntary counseling and testing, because you find individuals in those areas tend to have certain problems, especially the high prevalence of HIV in these areas. So those are the 4 clinics. The other clinic that are part of the 4 clinics, one's on the Brahma in the south coast and one's at Malagasy in a peri-urban area south of Isipingo.
Well, some 2 years ago, there was a need to provide hemodialysis to patients that were being refused by the state hospitals. And one can understand why the state was refusing, because it's a very costly operation. And there are certain strict criteria before patients are admitted to hospital for dialysis. And one of these criteria is that they mustn't have any chronic diseases and that they should be less than 50 or 55 years of age. And there was a tremendous need now to provide for dialysis for these patients who were unable to access medical aids and therefore now were left to the community to provide some form of dialysis. So the IMA, in fact, came to the rescue of such patients, and today we have a unit that is based at the Shifa Hospital, and we have about 15 patients who are being dialyzed on a regular basis. One of the main reasons for providing dialysis is not only its life-saving, but also for the greater community to create an awareness that you need to take care of yourself, you need to prevent illnesses, and if you do have diabetes, hypertension, which are the most common reasons for dialysis in the long term, that you need to have these illnesses well controlled.
I am thankful to IMA for providing me a free treatment.
The Islamic Medical Association has been in existence for some 30 years, and we would really like to see it go another 30 years and in a very strong way. So membership is a major problem, and the more the members we get in, young people coming into the organization, young men and women, that will take the organization forward. So we have many challenges, and also we want to project the Islamic identity within the professions that members practice.
When we started, we launched a South African IMA, but immediately we also started looking internationally. And in 1981, there was a conference in Kuwait held by the Ministry of Health over there. We were very lucky, we were invited to it, and we went up there, and there we met people from other countries, and we sowed the seed that we should have an international body as well. So then the following year at IMA of North America conference in Orlando, we met and 9 countries came together, and we formed officially the FEMA, the Federation of IMAs, which exists. It has grown enormously. It is over 20-odd countries are members. They have Islamic hospitals as a subcommittee. They have the ethics subcommittee. They have the board of education. It's a phenomenal growth of this international body of FEMA, which is locally. We have grown in the sense that we have established active branches: Klerksdorp, Ladysmith, Pretoria, Johannesburg, of course, Cape Town, Polokwane. We've got a fairly active branch for Shepson. So we've got quite a lot of active branches. So these are active branches where they are doing work at different levels. The biggest activity is still in Durban, which is the mother branch and mother body. But other branches are also active, and particularly Klerksdorp and smaller branches are doing enormous work in Johannesburg as well. We also have publications. Publications, one is where we have communicate with our members, which is our bulletin. We also have a journal, which brings in the type of articles which you won't see in the normal journals, with articles on Islamic medicine, medicine from Islamic health, alternate medicine, etc., different articles, and our body being a body not of doctors. I think this is one of the things which we need to quite clear. It's a body of Muslim health professionals.
The Islamic Medical Association has been involved in publishing various books, booklets and journals for the past 20 years. The Journal of the Islamic Medical Association, or JIMASA, Journal of Islamic Medical Association of South Africa, is published 3 times a year, and this is involved looking at research articles, peer-reviewed articles, original research, editorials, and report back from conferences. There are book reviews there as well. Then the Bulletin of the IMA, the BIMA, this is more in the form of a newsletter. This is published every 2 months, so that's about 6 issues a year. This is keeping the branches in touch with each other. So it's like a newsletter, advertising forthcoming events, also highlighting events that have occurred, and it also a spot for any new articles to come out, and also to look at current health issues.
In the Klerksdorp regional area, of which I am the chairman of the Islamic Medical Association, we have a number of projects within the community. Initially, some 8 years ago, we started with Operation Winter Warmth, which reaches out to the community in need during the winter months. We've got the Halal Food Security Program to the AIDS orphans, and a special Halal Food Security Program to patients at the state hospital receiving ARVs at the wellness clinics. We have educational programs on HIV, STDs, Islamic lifestyle at the Islamic centers and the various schools in our areas. And a special point within the schools, we have recognized students who excel in mathematics and science. And on that special occasion, the IMA presents special awards to them. You'd be surprised that so many of our underprivileged schools don't have a special awards day. And this, as a niche for the IMA, has been a tremendous success. Over the years, we've developed the educational program at schools, Islamic centers, and the local prison. And our work has been recognized by the Muslim AIDS Project, and it is being funded from last year in June. And every year it's being increased, and every month we have been able to reach more students, individual young people to these educational programs. Our cataract eye surgery program, in partnership with the Northwest Provincial Government and our local Klerksdorp Hospital, sees our ophthalmologist from the Gauteng project, Dr. Shabir Hussain, visit us annually. Although the numbers at the moment are small, on an average day he does 20, but 20 off the waiting list that runs into hundreds. We believe we are making a small dent and a great contribution to the state's outreach cataract program.
The South African Red Cross Air Mercy Services provide regular medical personnel to the rural hospitals of KwaZulu-Natal. And we get quite a number of practitioners. Myself, I go, and my wife also, she's a pediatrician, she also goes to these rural hospitals. And we go on a regular basis and provide assistance to any hospital which does not have sufficient medical personnel either for that day or for that period. And we stay and we help them out there as well. What we have done in some of the hospitals is that, particularly in Shlabisa, is that when we went there, we saw the situation and we realized that these people need just more than our visit there. And what we did was we initiated a training program for the rural nurses over there. And we were able to then bring them up to a level where they could manage particularly the neonatal cases and things like that. So we have been doing that as a service also, in going there regularly, in training the personnel that are present over there.
Our job entails medevacing the sick and the injured on the streets of KZN. And we face various challenges daily. And that's why we're very appreciative and we enjoy working and being supported by the IMA.
The South African Red Cross Air Mercy Service operates the Flying Doctor or Health Outreach Program in collaboration with the Department of Health in KZN. We serve a population of more than 9.3 million people in the province, and health resources are limited to the urban areas. To this end, we get on volunteer doctors, specialists, and allied healthcare workers to go out to the rural areas to serve the population. In this respect, we also get doctors and specialists from the other organizations such as IMA and other religious groups and we have forged a relationship with the IMA to get volunteers to go out to these rural areas on a regular basis. And many hospitals have been adopted, and cataract surgeries, urology patients, pediatric patients, obstetric patients have all been served through the IMA services.
One of our future plans is to produce an Islamic hospital, and this has come about because we have at the moment 3 to 4 clinics and we have a mobile clinic. These 3 to 4 clinics have been in existence for some 30 years, and now we feel it's time to move on and to provide a hospital, as there is a great need for a hospital. As you are aware, the state hospitals cannot cope, and we have the national health insurance very soon coming through. So the government is in fact looking for partners as to how we can assist communities.
We at the IMA decided as a committee that we need to empower people out from the public. We then decided, let's start off with HIV and AIDS. We then call pupils in, or learners as they are now called, from different schools with their educators, and we run workshops with them.
We have home-based care training, we have orphan and vulnerable training for the community workers out there, and then the very same people that we train go out there and provide caregiving to the ill people out there, and then they take care of the orphans, and then all we do is to make sure that we give them their stipends when we do have, or we just give them support, because, you know, working with people that are, you know, in different difficulties also has an impact on us as community workers. So there is this way where you are able to come back and also get some sort of support.
The plan is to take our projects to further cities like Freiburg, Rustenburg, Wolmeranstad, Ventersdorp, and to become more involved in those communities as we progress into the future. The confidence we have received and the support that we have in all these towns already augurs well that we will definitely have partners as we go forward into the future. And for us, it's a humbling and satisfying experience that Almighty Allah has blessed those who work so dedicated and so devotedly that they are finding so much satisfaction.